The National Primary Healthcare Development Agency, NPHCDA, has partnered with Tabib Pharmaceuticals Limited to offer free medical services to residents of the Federal Capital Territory, FCT. Approximately 2,000 residents in Jiwa, Abuja Municipal Area Council, and Kedah Shoho in Gwagwalada Area Council benefited from the outreach. Dr. Rukaya Wamako, Acting Executive Secretary of the FCT Primary Health Care Board, Health Services and Environment Secretariat (FCTA), said medical services were brought closer to serve the less privileged, especially women and children.
As we all know that there is shortage of manpower, health manpower in particular, because people are leaving the country for going for greener pasture, people are retiring, people are dying, and then we are expecting employment to be done by the federal government. The message I will pass to them is that this is free and it has come closer to their doors. They should come out in their numbers to come and access it. It is free. So both the children, the women, the youth, the boys and the girls, all of them, including people with disability, including elderly people, men and women, they should come out in their numbers to access this privilege, and because it's a privilege, because it has come closer to them. And then if there is anything that they either referral or they want to continuity, because this one is something that we do in a certain days and then they go back to the primary healthcare facility. They should be linked with the primary healthcare facility in Jua here. We have two primary healthcare facilities here. We have the center, we have the clinic, and then we all have our healthcare workers there where they can go and continue their treatment from there.
Also speaking, Dr. Uday Sylvester, Deputy Director and State Coordinator, NPHCDA North Central Zone, said the outreach is a platform for local governments, area councils and wards in need of healthcare services.
Our primary healthcare centers are distributed all over, all the states and wards. And the population within the catchment of those health facilities receive these health services from our healthcare workers, owned by the NPHCDA, operated by the State Primary Healthcare Development Agency under PHC under one roof, and then manned by the PHC staff. Whatever they render to the community will never be enough. So we always need collaboration from independent organizations like this, public-owned NGOs, and also foundations to extend additional free medical services to communities.
Dr. Emeka Odezue, Senior Medical Consultant, Tabib Pharmaceuticals Limited, said the outreach, backed by NPHCDA, could impact lives as the government cannot do it alone.
And sometimes within the government itself, they may not have the people themselves to go. So that's where people like us come in. Government says, okay, we want this thing to be done here. We don't have the people. Can you do this for us? And we say, yes, we can do it for you. Okay, we started a bit late, but we want to increase the speed. We want to get at least 2,000 people, men, women, and children. So far, the people that we've seen are a bit elderly. We are passionate about what we are doing. We think it is good for the community, and we think that if it's good for the community, it's good for the country. The community is out in full force. We expect more to come. Okay, this is Jiwa. Jiwa is part of one of the Emirate councils in the FCT. The Emir has been very supportive to give us this location. So I believe it can be replicated. It just requires just a little effort and particularly a little desire.
For his part, the project manager, Tabib Pharmaceuticals Limited, Tony Eleme, said the medical outreach is one of the organization's core intervention services under its annual corporate social responsibility.
Jiwa was taken because we did, some level of research and conversations we had with community leaders, market women, and some medical officials in this community. So we discovered that this is one of the local communities, rural areas in Abuja, where healthcare services has been a huge challenge because you can see most of them are poor. A lot of them cannot afford the cost of medical services and care. So we decided to identify with them, to bring this thing to their doorstep and, give them the free service.
Another partner, Ms. Nkiruka Udezue, president of Nikki Udezue Foundation, said the foundation is the project's implementing partner to render quality health care to the grassroots.
We're here to support Tabib Pharmaceuticals. They are having a free medical outreach sponsored by the primary health care, and we're here to implement the project with them. There's quite a lot going on here today. They have a very full laboratory here to check on the patients, a very full pharmacy as well to give out lots and lots of drugs, malaria drugs, hypertension, diabetic drugs. So I think as medical practitioners, they are going to see a lot of other things right here today. So they are prepared. From what I can see, it's a very excellent team that came to Jiwa today.
A beneficiary, Maimunatu Ahmed, thanked the organizers for the drugs and other materials she got.
Okay, see the dress here where they give us for this our community. See, I'm very, very happy for this our medical checkup. See my show they give me, I'm very, very happy.
Another beneficiary, Mr. Salisu Mohammed, a 67-year-old man, said it was the first time he was experiencing free treatment.
They tested me, my VP, my everything. Then they attended to me. I'm happy with them, and they give me some drugs to go and drink. They tell me how we take the drugs every day. So I'm so happy, and I pray for them. I pray to the Almighty God to give you people good health, long life, and prosperity. You people